Have you eaten yet? If not, feel free to grab some snacks for this lecture. In this lecture, we'll be covering the digestive system and nutrition. Let's talk about the organs first. To say organ, it is 器官. Gum is 牙龈, and tongue, 舌头. The salivary gland will be 唾液腺. 唾液 is saliva, and 腺 means gland. The pharynx is 咽, and larynx, 喉. The throat area altogether is 咽喉. Esophagus is 食管. Stomach is 胃, and pyloric sphincter, 幽门. The duodenum is 12指肠. 12, of course, meaning 12, and 指 is fingers. The small intestine is 小肠, and the colon is either called 大肠 or 结肠. The appendix will be 阑尾. Rectum is 直肠, and the anus, 肛门. Diaphragm, as we've said in previous lecture, is 横膈膜. The abdomen in Chinese is 腹部, in the abdominal cavity, 腹腔. 腔 meaning cavity. The peritoneum will be 腹膜, 膜 meaning membrane. Liver is 肝, and the gallbladder, 胆囊. Bile is 胆汁, and the bile duct, 胆管. The pancreas is 胰腺. Again, 腺 meaning a gland. The spleen, on the other hand, is 脾脏. To say epithelium or epithelial cells, it's 上皮细胞. Mucus is 粘液, and microbes, 微生物. Bacteria will be 细菌, and virus, 病毒. The microbiome will be 微生物菌群. Here are some translation notes. The throat is generally covered by 喉咙, which describes both oropharynx and larynx. You can ask the patient 是在口腔后部还是喉咙深处 to specify the location. 口腔后部 meaning back of the mouth, and 喉咙深处 meaning deep of the throat. Colloquially, you may see patients using 胃痛 and 肚子痛 interchangeably. These actually refer to different pains in the stomach. Remember that 胃 specifically means the stomach organ itself, and 胃部 is the epigastric area, whereas 肚子 is the whole abdomen, and it can be any of the 4 quadrants. So when your patients say 胃痛 or 肚子痛, it may be a good idea for you to ask them to specify. For the next few lectures, we'll see that words that describe bodily functions or if or discharge are often used as profanity. Remember that 肛门 is the medical term for anus, and 屁眼 is not acceptable in medical settings. There are significant differences in traditional Chinese medicine and Western medicine regarding the organ of spleen or pi. In traditional Chinese medicine, it is considered a digestive organ that distributes the nutrients and it has no immune functions. You may see that patients use traditional Chinese medicine concepts or disease descriptors for this organ, and in any doubt, you should always ask the symptoms that patient is experiencing. You should also know that 脾气, qi meaning gas, has nothing to do with the spleen organ. It means temper or anger in Chinese. Here's some practice. To say most of digestion and absorption occurs in the small intestine, colon mainly absorbs water and provides space for gut microbiome. In Mandarin, that is, 消化和吸收主要在小肠里进行，结肠主要吸收水分，并为肠道菌群提供空间。To say liver or pancreas secrete digestive juice that breaks down food, blockage in the bile duct can cause significant damage to these organs. 肝脏和胰腺分泌消化液分解食物。胆管堵塞会严重损伤哪些器官？堵塞 meaning blockage. Here are some symptoms you may see for the GI system. To say lack of appetite, you can say 没胃口 or 食欲不振. Both 胃口 or 食欲 means appetite. Dysphagia or difficulty swallowing would just be 吞咽困难. Hiccup is 打嗝. Indigestion, 消化不良. Bloating is 胃胀气. 胀气 meaning a gassy feeling. Abdominal pain will be 肚子疼, and epigastric pain 胃疼. Bowel movement, you can either say 排便 or 大便. 大便 can also be used as a noun to refer to the excrement. Blood and stool will be 便血. And diarrhea is either 腹泻 or colloquially called 拉稀. Constipation will be 便秘. And to say flatulate, you can either say 通气 or 放屁. Heartburn is 胃灼热. Nausea is 恶心 and vomiting 呕吐. To say regurgitate, it will be 反流. 反 meaning opposite and 流 meaning flow. Weight loss is 体重下降 or 掉体重. Jaundice is 黄疸 and ascites 腹水. Lastly, hematemesis is 呕血. Now for the GI conditions. Ulcer will be 溃疡. So you can say 胃溃疡 for gastric ulcers or 十二指肠溃疡 for duodenal ulcers. Perforations will be 穿孔. 孔 meaning hole and 穿 meaning going through. H. pylori will be 幽门螺杆菌. Gastroesophageal reflux disease will be 胃食管反流. And C. difficile colitis, 艰难梭菌结肠炎. Since most patients don't know the name of the bacteria, sometimes you can say 结肠炎 to just refer to the colitis. Gastritis, on the other hand, is 胃炎. And pancreatitis, 胰腺炎. Cholecystitis will be 胆囊炎, and cholelithiasis is 胆结石. On the other hand, choledocholithiasis will be 胆总管结石. 胆总管 meaning the common bile duct. Hernia is 疝气. And hepatitis A, B, or C will be 甲乙丙型肝炎. Instead of saying A, B, and C, we use 甲乙丙 to denote the different types. Steatosis is 脂肪肝. And cirrhosis 肝硬化. 硬 meaning solid. Bacterial peritonitis will be 细菌性腹膜炎. To say viral gastroenteritis, you can say 急性肠胃炎 or simply 肠胃炎. Irritable bowel syndrome will be 肠道易激综合症. 易激 meaning easy to be stimulated or irritable. The inflammatory bowel disease, on the other hand, is 炎症性肠病. 炎症 is inflammation. Food poisoning is 食物中毒. Gluten has 3 translations. The scientific translation is 谷蛋白, and the colloquial ones will be 面筋 or 麸质. So celiac disease can be translated as 麸质不耐受 or 谷蛋白不耐受. It also has a medical term called 乳糜泻. Hemorrhoids in Mandarin is 痔疮. The diverticula is 气室, so diverticulosis will be 气室病, and diverticulitis is 气室炎. To say vitamin deficiency, you can say 维生素不足. Lactose intolerance, 乳糖不耐受. And as you can see, 不耐受 meaning intolerance. Obesity is 肥胖, and eating disorder 进食障碍. 障碍 meaning a barrier. Lastly, you may hear the term 水土不服. It means not being used to the climate. As I have mentioned briefly, 大便 refers to both stool and defecation, whereas 排便 only refers to the action of defecation. If you translate bowel movement word by word, it will be 肠胃运动 in Mandarin, which means peristalsis instead of defecation. To say passing gas, you can either say 排气 or 放屁. 排气 is the polite term, and 放屁 is commonly used but also can be used as a swear word. To say vomiting in Chinese, it will be 呕吐, whereas emesis, the product, is 呕吐物. In review of system, you might ask the patient if they have any weight loss, mostly an intentional weight loss. And in Mandarin, it can be 体重下降 or 掉体重, whereas 减肥, another term in Chinese, means intentional weight loss. The celiac disease prevalence in China may be actually low, but it could also be due to a general lack of awareness in both the provider and the public. So celiac disease is less diagnosed. For the translation of gluten, you may say 麸质 pop up on most food containers. Lastly, 水土不服 is a widely accepted traditional Chinese medicine concept which describes illness and discomfort, usually GI discomfort, like constipation, diarrhea, or vomiting, due to change in geographic area, food, or climate. Here are some practices. To say heartburn is a common symptom in GERD because stomach acid irritates the esophagus, it is sometimes hard to differentiate stomach and heart pain. 胃灼热是胃食管反流的常见症状，因为胃酸会刺激食道。胃痛和心脏疼痛有时候难以分辨。If you're explaining to the patient that 很多种疾病都会导致腹痛或腹泻，因为您有症状有一段时间了，我想有可能是肠道易激综合症或者乳糜泻。That means you're saying many conditions can cause stomach pain and diarrhea. Because you have had symptoms for a while, I think it may be IBS or celiac disease. Here are some tests commonly run for GI issues. To say urine analysis, it will be 尿液分析. In stool analysis, 粪便分析. The H. pylori breath test will be 幽门螺杆菌呼气测试. Barium swallow, or contrast studies, will be 吞贝检查. Bei is barium. To say endoscopy, it's 胃镜 or 内窥镜检查, whereas colonoscopy will be 肠镜 or 结肠镜检查. Enema is 灌肠, and PET scan 正子扫描. We talked about CBC the last lecture. Now we're talking about the complete metabolic panel. Sodium is 钠 and potassium 钾. Chloride 氯 and carbon dioxide 二氧化碳. Calcium is 钙 and glucose 葡萄糖. Blood urea nitrogen will be 尿素氮 meaning nitrogen, and urea 尿素. Creatinine will be 肌酐. Total protein will be 总蛋白 and albumin 白蛋白. Globulin is 球蛋白 and bilirubin 胆红素. You may see direct or indirect bilirubin as 直接 or 间接胆红素. The liver function test 肝功能测试 and coagulation test 凝血测试. My hope is that you don't necessarily have to memorize these terms to explain some tests to the patient, but if the patient hands you their medical test in Mandarin, you may have some idea of what's going on. And let's talk about some treatment for GI conditions. To say diet change, you can say 改善饮食. 改善 meaning to better. Antacids will be 抗酸药. And proton pump inhibitors, 质子泵抑制剂. Antiemetics will be 止吐药, whereas prokinetic medication will be 肠胃动力药. Minimally invasive surgery will be 微创手术. 微 meaning minimum or small, and 创 meaning trauma or incision. Appendectomy will be 阑尾切除术. 切除术 is ectomy. So cholecystectomy will be 胆囊切除术. Gluten-free diet is called 无麸质饮食. The probiotics 益生菌. 益 also means beneficial. Enzyme supplements will be 补充消化酶. Lactase is 乳糖酶. And lastly, multivitamins, 综合维生素. The word diet, when referring to the kinds of foods you're eating, that will be 饮食 or 饮食结构. but we also use diet in the colloquial sense of reducing caloric intake. That in Chinese is translated to 节食. I've provided the AST and ALT translation in the workbook. However, you might just want to avoid this jargon and explain it as a liver damage test, since they do measure the enzyme spillover from opened up liver cells. So that will be 测试肝损伤, testing liver damage. Your patient might also not understand what 质子泵抑制剂 is. So explaining the effect of the PPI may be worth a lot more. To say reducing stomach acid secretion, you can say 减少胃酸分泌. Here are some practices. To say we need to draw some blood to measure glucose and do a liver function test, that will be 我们需要抽一点血测量葡萄糖和测试肝功能。做胃镜和肠镜的确很不舒服，但是是诊断的唯一办法。That means endoscopy and colonoscopy are indeed uncomfortable, but these are only methods to reach a diagnosis. Lastly, you can explain 控制乳糜泻的治疗办法是改变饮食，不吃任何带谷蛋白的食物。That in English will be treatment for celiac disease is diet change, avoiding any food with gluten. Lastly, let's talk about nutrition. To say metabolism, that is 新陈代谢. 新 meaning new, 陈 meaning old, and 代谢 loosely translates to exchange. Serving will be 份 or 分量. Calorie is either translated as 热量 or phonetically to 卡路里. Intake is 摄入, and exercise will be 锻炼. To see carbohydrate, that will be 碳水化合物. 碳, of course, meaning carbon, and 水, water. Sugar or added sugar is 糖 and 添加糖. Starch is 淀粉 and fiber 纤维. Protein is 蛋白质 and amino acids 氨基酸. Fat is 脂肪 and fatty acids 脂肪酸. For the different kinds of fat, the saturated fat is 饱和脂肪 and unsaturated fat 不饱和脂肪. Lastly, trans fat is 反式脂肪. 反 meaning the opposite, and in this case refers to hydroxyl group being on the opposite side of the double bond. Micronutrients will be 微量营养素. Some of them you may see is iron, 铁, zinc, 锌, copper, 铜, and magnesium, 镁. Cholesterol is 胆固醇, and vitamin, 维生素. Folic acid is 叶酸. Vegetables, 蔬菜, and fruit, 水果. Grain is 谷类. Dairy, 乳类 or 奶制品. Soy, 豆类. The red meat, 红肉, and poultry, 禽类. Vegetarian will be 素食, and vegan will be 纯素 or 严格素食. 严格 meaning strict. The Mediterranean diet will be 地中海饮食, and ketogenic diet, 生酮饮食. Here are some translation notes. 份 is used as a measure word. To say a serving of, that will be translated as 一份. 蛋白质 can sometimes be abbreviated as 蛋白, but the short term 蛋白 also means egg white in Chinese. So if there's any confusion, use the full term 蛋白质. Lastly, you might hear people say 素菜 or 荤菜. And 素菜 refers to any vegetable-only dish, and 荤菜 meaning a dish contains meat. Here are some last practices for this lecture. The Mediterranean diet is high in vegetable, fruit, unsaturated fat, and low in red meat. It is a diet that improves cardiovascular health. You can say 地中海饮食富含蔬菜、水果，不饱和脂肪，少有红肉。这种饮食有利于心血管健康。纤维摄入不足对肠道健康不利，会导致便秘、痔疮甚至结肠癌。In English, that means the lack of fiber intake is bad for intestinal health and may cause constipation, hemorrhoids, and even colon cancer. 食物中毒导致的大量腹泻和呕吐会导致电解质紊乱，可以通过血液检查出。That in English will be, excessive diarrhea and vomiting caused by food poisoning can lead to electrolyte imbalance, which can be detected by blood test. 电解质 is electrolyte, and 紊乱 is imbalance. 长期服用非类固醇类消炎药会导致肠胃溃疡或出血。In English, that would be, taking NSAIDs long term can cause stomach and intestinal ulcer and bleeding. 锻炼和饮食调整可以用于治疗轻度的脂肪肝。That will be, exercise and diet change can treat mild steatosis. Lastly, to ask, are you experiencing any diarrhea, vomiting, nausea, abdominal pain? That will be, 您有任何腹泻、呕吐、恶心或腹痛吗？ Thank you for tuning into this lecture. If you did grab snacks, I hope your appetite hasn't been affected by this lecture. As always, there's been no conflict of interest. The text in the slides and the workbook is written by me, and with additional help from members of CMAC at UCLA. Video editing is by Jasmine. Thank you and see you in the next lecture, where we'll be talking about diabetes.